Okay guys, welcome back to Blackwood Vascular. Here's a little clickbait to get some views. Anything for the views, but in reality what we're doing is talking about graduated compression stockings. I have no idea why every company decides to put this woman on the picture. Why don't they put a leg like my leg up there instead? Because actually, those are the people who need to be wearing these things. So, the reason for the video was I made a short about this, but I wanted to make a little bit longer because 3 minutes was just not enough to talk. But the question was asked: Do graduated compression stockings actually decrease the risk of venous insufficiency? And to that point, we should also add in: Does putting on a multi-layered wrap with Curlex and ACE bandages, wrapping it around the leg, or a Coban, similarly trying to squeeze that blood kind of up the leg? Here's my varicose vein patient's leg. But does wrapping the leg, putting a nice wrap on, and always remember to squeeze tighter, cover by a half, don't make any lines form, that whole thing. And basically what you're doing is trying to squeeze like you'd squeeze a toothpaste, like if you're my mom, trying to teach me how to squeeze the last drop of toothpaste out of that vial so we don't have to buy more. But you're trying to squeeze the blood up the leg, just like that, to kind of make sure that, and you go all the way up the leg, and you really want to go as high up as you need to go to cover any branches that might be refluxing. Wherever there's a valve, where there's actually a problem, that's where you actually need to cover, right? So you don't want to wrap to here, and obviously you can wear compression stockings this high. Bombas is a company that makes some different heights of compression socks, but whatever it is should be graduated, meaning if it's 20 to 30, it's squeezing 30 here and less and less and less, and by the time you get to a knee high at 20 millimeters of mercury, or a thigh high, it's 20 up here. But the point is that you're squeezing lower and lower. If you're wearing compression stockings and you're having cramps, by the way, you're wearing the wrong size, or you're wearing the wrong strength. But something is wrong, and I think what's happening in most of those cases is that there's something tight. It's too tight up here, and not every leg is this leg. So some people have a relatively skinny leg and a big thigh area, and the compression socks are not made 3D printed specifically for you. So if that's happening, try to cut a slit in the compression stockings at the top and see if that helps, or maybe cut the whole top off and see if that helps. But you need to figure out a way that it works for you. But cramping would suggest that the blood, you're having vein hypertension, you're squeezing and shutting down that vein, and all this is becoming actually bulged up, and then you're starting to have calf cramps because the blood is not flowing, circulating well. That has happened to me also. So, and I have a very muscular, I'll just say muscular thigh as a soccer player. But anyway, with that said, the question again is, does compression stockings actually reduce the progression, or actually stop or prevent the progression of varicose vein disease? And I would say that I was shocked, because I always tell people, yes, it does. But the reality is, I don't have any proof of that. I still think it does. I still know it does in my heart. But do I have actual proof that I can say as a physician to patients out there that there is actually, if you wear compression stockings for 20 years, you're going to actually have less vein disease? I mean, it makes obvious sense to me, but I don't have any data. I cannot find online a single randomized controlled trial where they put up 10,000 people with at age 20 or age 50 against another 10,000 on the same age, same level of disease, and they compared them over time and saw if they ended up having worsening outcomes. The ideal study would be something just like that, where you would put, one group of people here, 10,000 patients with compression, and I'm putting big numbers down. Patients without compression, and you put two different arms, and you do a randomized trial, a RCT, randomized controlled trial, where all the parameters are controlled. You know that the patients really were wearing the compression. Better yet, a double-blinded randomized controlled trial where the physicians, I don't know which of the patients actually were wearing it, and which ones we're not, and the patients are also putting something on their leg, one of which is a real compression stock, and the other one is some fake thing that's tight, or I don't know. It would be hard to actually do that and not somehow alter the results. I mean, even putting a compressive thing on that the patient wouldn't know if their leg is being compressed or not, I don't think that's possible. If their leg was being compressed in any way whatsoever, we would then have to ask or question at the back end, well, was it the compression stocking that made it better or not? I guess one thing you could do is you could do 10,000 patients with 10 to 20 and 10,000 patients with 20 to 30 and see if you can get a signal there that the more compression, the better it was. But nobody has ever done a trial like that. And so I don't think we ever will have the answer to this question definitively to say yes. But what we do have is tons and tons and tons of trials where we see people with VCSS scores that are high, 15 to 20, and they wear compression for some period of time, and their scores drop slightly, 12 to 15. We also have people with ulcers who, when they wear compression, their ulcers heal faster. People who wear compression and their ulcers come back. The people who are kind of like borderline SEEP, what we call SEEP 5 versus 6 or 4 versus 5. And 4 is a patient who's almost about to form an ulcer. 5 is a person who's formed an ulcer and the ulcer is healed. 6 is a person who has an active fleshy wound that's not healing due to vein disease. And so these people, when they wear compression, the ulcers heal quicker and come back less often. And that's the whole basis of vein disease, is that by lowering the amount of pressure in the leg, you are now able to heal ulcers, and by proxy, everything else feels better. So you have less symptoms of heaviness, swelling, tenderness, itchiness, cramps in the nights, restless legs, and all those symptoms that come with a swollen leg because you have lowered the pressure in the leg. And so yes, the question is, do we have long-term proof that this actually is due to that compression will actually lower it? I've always told people yes. I don't actually have proof behind it. But what I do have is proof that compression stockings in people with really severe disease helps their symptoms and actually heals them. And similarly, if patients have a good result from compression, they typically have a good result from procedures. And if you have leg swelling because of some other issue, heart disease or poor protein intake or whatever else, you might have some benefits from compression still because you've lowered the swelling, and so you've lowered the skin damage and the inflammation of the skin and the capillaries and everything else that goes along with having a swollen leg, and you prevent the amount of episodes of cellulitis and infections that come along with having blistering and bursting open of the skin that's all swollen. But the truth is that you may not get the same benefit in those patients if it's all heart disease. If it's nothing to do with the veins, you may not get any benefit from treating with a procedure, right? And we have lots of procedures that we can do, injecting sclerosants to burn the veins and shut the veins down. We have things like the tried and true. Here's a good example: the laser. Laser therapy has been probably the best studied forever. This is a laser device, and the laser is at the tip of the catheter. You slide this inside the vein, and you burn the vein, and you get rid of the vein that way. These are all for the incompetent veins. So you essentially slide that catheter right up inside of the saphenous vein. And in the case of laser, you would start a little higher because you don't want to hit the nerve. And if you can see on my little drawing of my nerve there, the nerve separates a little higher, lower down, but you'd want to burn this portion of the vein, right? You have other procedures like VenaSeal. Here's the VenaSeal device, basically building off the laser. Here's your wire, here's your catheter sheath. You put this all inside the patient's leg, inside of their vein, and then this is just a caulking gun. You squeeze it, and the glue comes out and glues up the vein shut. That one doesn't use any heat. That way, with the VenaSeal, you could actually start lower down because you don't have to worry. Even here where the nerve is closely adherent, closely stuck to the vein, you don't have to worry about skin damage here, or you don't have to worry about burning the nerve as you would with laser or radio frequency ablation. And so, you know, these are all procedures that would help you, but you already would be helped just by wearing compression. So if anybody believes that compression does not help symptoms of or progression of vein disease, then they also by proxy should believe that none of these procedures help either. So it's just a matter of how much are you expecting to get out of vein disease, etc. Right, and just showing you one last one. Here's a box with a radio frequency catheter. This is RFA. It's again a burning technique where you similar to laser, where this area gets hot instead of that. But in either case, my point is, I guess, is really for class 1, SEEP classification 1, and I have a video about what the SEEP classification is. This, let me see if I can get my eraser here. Oh, wait, look at this. I found a handy dandy eraser right there. So, class 1 disease, if you look at SEEP classification, check out my video on that. Class 1, class C0 is no disease, right? And when you get to C3, you have swelling, right? Here you have varicose veins, and here you just have spiders and stuff like that. And these are symptomatic with pain. But when you, in this early phase, do these people, by wearing compression at 0, do you stop the progression to 1 or 2 or 3? I think you do. I really do think you do. I really honestly believe it. And I think if I didn't believe that, then I don't think I could recommend anything in medicine. I don't think I could recommend exercise or eating a healthy diet, because I wouldn't believe that eating a healthy diet stops heart disease. I mean, are there people who probably eat kale all day and then they develop a heart attack? Sure. I mean, are there people who've smoked until they're 100 years old and naturally they come back to me in clinic and say, well, my grandfather never ever had a problem and he smoked like a chimney? Absolutely, there are those people. But do you want to play Russian roulette and be that and take those chances? And to that point, another thing that came up was how much to wear compression stockings and how often. There's all sorts of stuff about this. Most physicians just give the boilerplate: wear the compression in the day, take it off at night, blah, blah, blah. I once met a patient who had darkening of the skin in her legs 5 years ago up in Syracuse. And I told her to wear it every day if she wanted to and wear it at night if she wanted to. She did. And guess what happened? A year later, she came back and showed me her legs and said, listen, I never took them off. I even slept in them. And her disease went backwards. She went from, I think, C4, which is like skin changes, the dark brown skin with the thickening of the skin, and almost like early ulcers. She went backwards to kind of like a C3. I mean, she still had some skin changes, but it was remarkably different when you look at the two photos. And she basically just said she wore it every single day. I cannot convince one of my patients to do it, and I wouldn't want to tell any of you guys out there to go and wear compression every day, every night, because guess what? I have worn them and I hate them. I honestly hate them. But am I going to recommend them? Yes. Do I love a nice, juicy, medium rare steak, Brazilian style, cooked with rock salt over my father-in-law's barbecue grill? Absolutely I do. Absolutely. But am I going to recommend that to you? No. Go out there and have your kale salad tonight, guys. Yeah. And so, with that said, what else can we talk about? We do know that compression stockings and wraps and bandages improve symptoms, reduce swelling, improve quality of life, and is the primary therapy for all patients with chronic venous disease. And it's a bridge therapy for patients who are waiting for their vein procedure. So even all my patients who have vein disease, I tell them to wear it. And then when you get your vein procedure, you still wear it. I know all these doctors who tell patients they don't need to wear compression stockings. I don't know, if you had spider veins and you're so concerned that you'd actually spend $250 and get an injection and treat your veins, or whatever the price your doctor might charge you is, then why would you not wear compression at least sometimes, maybe in the winter, to just stop that from progressing and happening more again? And it may be just because you don't believe. Maybe the doctor told you something else. I think after compression, after each procedure, we recommend typically our patients immediately put on the compression stockings and wear them. And it looks like my patient is now ready. The ultrasound has been completed, so I'm gonna be wrapping up quickly. But we use it because it reduces the amount of pain, the swelling, and the phlebitis. And what else? You have to, of note, you have to know what grade compression you're using, and you have to know how much you're gonna use, how often you're gonna use it. I cannot tell people who have a busy life to wear it all day, every day. I also similarly cannot tell a 90-year-old lady to put on 30 to 40 compression, thigh highs, if I know they can't even get on a 15 to 20 sheer compression stocking. So I tell people that when it comes to this stuff, you have to figure out your own. Just like how you figure out a pair of underwear, or you figure out what car to drive. You know, I mean, you have to figure some of this out on your own, and you have to trial and error over the years. But to just give up after wearing one pair really is kind of just giving up too quickly on your own health. And for the men out there, guys, it's not a big deal to wear some stockings. You can put the socks on over the stockings, and you don't have, nobody has to know. All right. So I know that there's a huge stigma behind, and I think it's really because of these kind of pictures. There's never ever any like construction worker, and that's why the guys show up with these massive night crawlers wrapping around their leg, and they're like, I don't know why I'm here. I'm here because my wife told me to come. I don't know, man. Maybe you should be here because of your own health. So with that said, there's good evidence, and this is the really good evidence for ulcer healing times. Compression definitely heals ulcers, and it prevents the ulcers from recurring. If you take nothing else from this, this is what you should take out of it, is that strong evidence for healing. The time it takes to heal an ulcer speeds up, and that's why we also treat the refluxing veins with procedures, and preventing ulcers from returning. There is so you see the best benefit here in the most severe. There's some weak or I should say moderate evidence, but good enough that we recommend it. Moderate benefit in patients with C2 symptomatic painful varicose veins. And then really no evidence that I can find, at least, for C0 and C1. I think maybe C2, there may be one or two little observational studies, but if you look at it here, the answer to that YouTube question is no evidence for C0 and C1 in the progression of asymptomatic patients. C1 patients have telangiectasias, reticular disease, and a few varicose veins, and they have no symptoms from it. They know that the vein is there, but they have no symptoms, right? And so these are small veins that probably are minimally competent, or minimally incompetent, and really just don't make the qualification in terms of how much blood they're refluxing down and how much symptoms they're actually causing to the leg, or the patient just doesn't notice it. At which point, what's the point of really treating, unless you're thinking about the 50-year plan? We need a large randomized control trial to look for early disease patients, but I don't think it's ever going to happen. And what else? That's about it. There's poor adherence. No, everybody's bad at wearing compression because of discomfort, difficulty putting it on, and itchiness. And of course, to remember is that none of these interventions that I've shown you today completely fix none of the interventions that we've done for compression stockings, changing it to different Velcro strap wraps or anything else, has actually fixed the compliance issue. People do not like to wear these things on their legs. People like to live free. So better long-term strategies are needed, and I think that's about it. I'm going to wrap it up right there and go see my patient, but good luck out there on your journeys, and I hope that answered the question of, does compression stockings actually help with varicose vein disease? If you like this video, please follow me along. This was all educational. It was all free. I'm trying to get to 1,000 viewers by December of this year. So 88 today.